Hello and welcome back. And always your favorite doctor. And if you're new here, please consider subscribing to our YouTube channel at Dr. on Wheels. But you can also follow us on TikTok at Dr. Itsuma. So today I want us to look at another very important topic, that is cervical incompetence, which is one of the major causes of recurrent pregnancy losses. So have you ever lost pregnancies, okay, recurrently, okay, at around the second trimester there, between 12 to 24 weeks, okay? So you have had recurrent pregnancy losses, okay, around 12 to 24 weeks. This video is for you. So let's get to it. But before we go to the today's topic, let's listen to some words of wisdom from the book of Luke, chapter 1, verse 49. The Bible says, "For he who is mighty has done great things for me, and holy is his name." So let's dive into today's topic. So, what is cervical incompetence? As we have alluded earlier, it's one of the major causes of pregnancy losses. So, cervical incompetence or cervical insufficiency, this is where the cervix painlessly dilates. So there is no pain, but then it dilates, especially during the second trimester between 12 to around 24, 26 weeks. And this one will lead to recurrent pregnancy losses. And what happens is, or even preterm birth, okay? And there is no labor. So when we say there is no labor, it means there is no that kind of abdominal pain with some uterine contraction. The pain is radiating to the back, okay? And it's increasing in frequency and intensity. No. So it is painless, and it just dilates, and then the baby just comes out, okay? So what are some of the causes of uterine incompetence or uterine or cervical incompetence or insufficiency? So the causes can either be congenital, that is you are born with, or they can be acquired causes. Now, for the congenital causes, okay, is number one, if you have had, you were born with deficiency or abnormal collagen. Now, collagen is that substance that basically make our muscles, it makes our tissues. So it's one of those tissues, okay? So it makes our tissues more strong. So the more collagen they are, it means the tissue is much more stronger. Like there will be a lot of collagen in this on the palm than on this side. That's why this place is a bit harder than on the other side. So if you have deficiency of collagen, okay, so it is something that is beyond your control. It's congenital, okay? So basically it makes your muscles weak. So you have weak muscles around the cervix, okay? So any kind of small pressure on the cervix, it just stretches out and it dilates. And then the other thing is people who are born with a small cervix, okay? And this small cervix, we are talking about a cervix that is less than 2.5 centimeters, okay? So if the cervix is less than 2.5 centimeters, you are at a higher risk of actually developing cervical incompetence when you give birth, okay? Or when you get pregnant. And then there are people who sometimes use some hormones, like there's a specific hormone that has been given, especially for people who have hormonal imbalances, called diethylstilbestrone. Okay, so of course, but rarely do people get this hormone, but it has been used previously. So those are some of the congenital causes. Okay, now acquired causes is number one, is either if you had an obstetric trauma. So an obstetric trauma means in your previous pregnancy, during the time of delivery, there was a trauma or there was an injury, and a major injury to the cervix. Let's say, for example, you had a cervical tear, okay, and it was not well repaired. Okay, so it made those muscles very weak, and therefore the subsequent pregnancies might dilate before the pregnancy's term. Okay. And then if there was some form of instrumentation, so let's say, for example, you had a miscarriage and then the cervix was so closed, but then the doctor had to dilate it manually to get those products of conception. Okay, so that process of dilatation, if it was not done meticulously, okay, it was not done nicely, it means then those muscles can become weak, okay, and then they can actually result to cervical incompetence. Okay, the second thing is when you have had a surgery, okay, around the cervical region as a result of a certain condition. Let's say, for example, you had an abnormal bleeding, and then after some speculum examination, you are told that we need to remove a small meat, okay, or what we call a biopsy from the cervix for it to be able to be taken to the lab. Okay, and then they do what we call a cone biopsy. A cone biopsy is basically removing a whole chunk of the cervix, okay, at the cervical os. Okay, so a whole chunk around to be taken for biopsy, especially for people who you are suspecting might be having cervical cancer, or what we call loop electrosurgical excision procedure, a LEEP. Okay, so it's the same. Okay, so there is a margin of part of your cervix that is removed. Okay, and then the other thing that can make as well the cervical muscles to be very weak is when maybe in your previous pregnancy you had a retained placenta. So the placenta was retained, and therefore the doctor had to manually remove it using their hand, and therefore they can easily make the cervix to be a bit much more weaker, and it can actually cause incompetence of the cervix in the subsequent pregnancy. Now, who are the people who are at risk? Number one is if you have had previous second trimester pregnancy loss or miscarriage, you are at risk of, you are one of those candidates that might be having cervical incompetence. Number two is, of course, history of surgery around the cervix. You are at risk of developing cervical incompetence. And then when you have had multiple pregnancies, now what happens with multiple pregnancies is that the more than one baby in the womb will mean that there will be more pressure on the cervix. Okay, now if the cervix is weak, it means then it can easily give in and basically allow the baby to come out. So the first thing is that you have either structural, okay, which can be acquired, or it can be congenital. So structural abnormality of the cervix. Okay, now with the growing baby basically exerts some pressure on the cervix, and because the cervix is weak, okay, it starts to dilate. Okay, and this can either lead to, number one, it can either lead to that baby coming out, what we call premature birth. Okay, but if it dilates, okay, we talked about a mucus plug that is around the cervical, around the cervix, that helps to prevent, as a mechanical barrier, that helps to prevent infection from getting in. So if you have had some issues, then it means then you can also get infection going in, like and causing chorioamnionitis, and that one can also lead to preterm birth. So how do patients present, or how will people present? Most of the time it's very painless, and we say that it is absent, the labor is absent, so it's painless. Okay, it happens between around 14 to around 28 weeks there. So it's that second trimester, mostly they are second trimester pregnancy losses. Okay, and the only thing probably that you might be feeling is some pressure around the pelvic region. Okay, so there will be some lower pelvic region pressure, okay, and then sometimes it can just present with gushing of the fluid, especially if there is rupture of those membranes, okay. So when you come to the hospital, once we do the examination, okay, so basically take a good history and do the examination. When you do a speculum examination, you can see the cervix dilated, okay, but there is no any kind of pain, okay, so there is no labor, okay. And sometimes, depending on how the size of the dilatation, you can even see the fetal membranes, okay, so you can see the fetal membranes, okay, yes. So basically diagnosis will make it clinically, okay. So we just look, we just take a good history, okay. There is history of multiple pregnancy losses, probably more than 3 pregnancy losses, and these pregnancy losses are around the second trimester, okay. So around the from 12 weeks to around 28 weeks there, okay. And then we can also do an ultrasound. Now when you do an ultrasound, you can see the cervix, okay, very short, less than 2.5 centimeters. But also when you look at the cervix also, okay, there will be either funneling. So funnel, you know how the funnel is. So inside where the baby is, it's wide, and then or it is a V shape, okay, so, or it can be a U shaped, okay. So that one is typical for a cervix that is actually dilating and it wants to be able to give way to the baby, okay. So how do we manage? So management basically can be medical management, but also surgical management. Now, medical management is basically what you can do, or what we call non-surgical management. What you can do at home. What can you do at home to basically give time for that baby to be able to grow to term before the cervix dilates? So number one, you need to avoid lifting heavy things, okay? Because with lifting of heavy things, it means you are increasing the pressure in the abdomen, okay? Because for you to lift something heavy, you need to tighten your muscles, okay. So if you tighten your muscles like that, it means you are increasing the pressure, and that one can actually lead to dilatation of the cervix. So avoid lifting of heavy things, okay. Avoid prolonged standing, okay, or even walking. People who walk for kilometers, okay, if you have had history of mid trimester, second trimester pregnancy losses, you need to avoid such kind of things. Probably you need to engage more on lighter duties, okay, but also more of resting. There are some drugs that you can also be given at the hospital that you can put in the vagina that basically helps to reduce the risk of preterm birth by at least trying to prevent shortening of the cervix. Now, what are some of the surgical management that can be done? So, number one, we have the 2 major procedures that can be done. That is the McDonald stitch and the Schrodinger stitch. But who are the people who are good candidates for this procedure? So, number one, if you have had more than 3, okay, previous mid-trimester losses, okay, you are a candidate for a suture. Number 2 is if we do an ultrasound and the cervix is dilated, the cervix is less than 2.5 centimeters before you reach 24 weeks, okay, you are a candidate for a suture, okay. So those are the 2 major things that basically look at to determine who can actually get the suture. And then the suture is done between 12 and 14 to 16 weeks, okay. And then there's what we call a rescue suture. So sometimes you can go ahead and if the cervix has not dilated very much, okay, and then there is no any signs of infections that have gone up to the baby, you can actually go ahead and do what we call rescue sacrilege. The good thing is that if you understand this and you are able to go to the hospital early enough, you are able to prevent such kind of pregnancy losses. So the complications can include infections going up, chorionitis, preterm labor. The cervix can actually be lacerated, okay? But also you can have uh, contractions can set in, especially with the infections coming in and all that. And those are some of the things that you need to try and avoid. Now that suture needs to be removed, okay, at exactly 37 weeks. Because if you don't remove and you go into labor, you can actually tear that cervix, and it can actually make it even much more incompetent in your subsequent pregnancies. Now, what is the outcome if you are taken good care of? Okay, so the outcome is that around 80 to 90% of the people who get their sutures will be able to carry their pregnancy into term. Okay, and the things that we need to avoid is, of course, we have talked about that. Okay, so for the doctors, they need to be very careful when they are using those instruments to be able to dilate the cervix. Okay, and then the other thing is we need to avoid putting things inside there. There are people who use different methods of sexual satisfaction by inserting big things inside their vagina that can actually touch the cervix and actually dilate the cervix. That makes the cervical muscles, okay, very weak. And if they become very weak, it means then you might be a candidate of cervical incompetence when it is time for you to give birth. Now, if you have found this lesson very helpful, please consider subscribing to our YouTube channel, that is Doctor on Wheels. You can also follow us in our social media platforms. You can also follow us on TikTok at Dr. Itsuma. Okay? And until next time, God bless.